Hi, everyone. Thank you so much for being interested in watching the recording. Before we jump on, I just wanted to let you know that I did stop the recording before questions. The reason for that is because I really value an intimate group and I really value an opportunity for people to confidently and comfortably ask questions. But there was some freaking gold in the questions that they asked. So I wanted to go through that. A lot of the questions were about the Advanced Women's Therapeutics program coming up in April. And a really good question, a question I get asked all the time is, I'm already a part of Women's Health Insider. What's the difference with Advanced Women's Therapeutics? So there's massive differences. And Women's Health Insider, to be honest, was brought about by everyone who'd graduated my course, wanting to stay up to date with the literature and just wanting more monthly content. So it is more of an update platform as opposed to a really comprehensive overview. Whereas Advanced Women's Therapeutics, every single week you get a recording that goes through the up-to-date literature on a condition, sure, but my exact protocols. That is why this does not qualify for category A, because this is the protocol and this is the dosing. This is exactly what I did in these couple of people in order to get them the results that we did. So you can walk away, and I highly encourage you to type out these protocols as you go and implement them in your practice the next day. So that's really important as in terms of a difference. It's a holistic overview to get you essentially a manual to a women's health practice. The second piece is that we meet live every single week to troubleshoot cases. Because one of the other questions that was asked, which was such a great question, is I'm really struggling with labs. Like I get a patient to pay for this blood work and then I don't know what to do with it. And so yes, we have an entire module specifically on the functional interpretation of blood work, what we're doing, like what types testing to run, what it means when it's high or low, how to interpret those. We have a whole module specifically on that, but then we're also going through it every single week. We are diving down to, this is what this pattern means. This is what this pattern means. It's about more than just a functional range and being like, oh, okay, it should be here to here. And what it means for that marker, it's about patterns. So we get into that and so much more in the program. For a group of 3 discount, that's when you contact me specifically and we'll give you a special coupon code so that everyone in your group gets $300 off, which is pretty amazing. And then we also, at the very end, have a coupon code for anyone who's interested in joining. So don't miss out. I hope you enjoyed this troubleshooting webinar. It was so much fun to put together. And I thank so much for watching it recorded and coming in live. Have a great day. And I cannot wait to work with you in Advanced Women's Therapeutics. All right, everyone, welcome. And thank you so much for coming to today's workshop on troubleshooting difficult cases. For anyone who is seeing this in recording, feel free to contact me with your questions. I know it's lunch hour, so a lot of people couldn't make it, but I still wanted to do it in any situation. So we will make this short, sweet, high impact. For anyone who's watched my lectures before, you know I talk quickly. I am kind of sorry about it, but not really sorry. I listened to my podcast on 2 times the speed. So we got through a lot in a short period of time. For anyone who is here live, don't hesitate to slow me down, ask me questions, anything like that. Because I'm going in with the general assumption that we're kind of middle of the way here, right? So you guys know enough to get you here, but you want to know what to do next level. And that's why we're doing this workshop. So we're going to dive in today to foundations of health, to how to think about business growth from the perspective of patient care. Because from my standpoint, I hear this all the time. And I think there's a huge place for it, but that we need to grow a business as entrepreneurs and we need to really understand how to post on social media and do this and that to grow a business. And I'm not saying that none of that is incredibly helpful. It is incredibly helpful, but at the same time, it's not sustainable, right? For the most part, if you get someone in the door and then you see them 1 or 2 visits and then they're gone because they didn't get results or didn't get the data that they wanted about their health, which is what we're going to talk about, you're just churning people. And so I've had to evolve and figure out how to be an entrepreneur as I went, but the foundation of me growing multiple practices has been in patient results. So, and then of course, we're going to get into troubleshooting cases. So let's dive in. Right now in the world, we are needed more than ever. And I feel so strongly about this. We are, at the time of this recording, a year into a pandemic. And it's a pandemic that has really, really brought about an awareness of what these health vulnerabilities are. I have more people in my practice now who are asking me for blood work. They're asking me for data. They're asking me what the difference between health and disease are, which is an awareness, and it's like a conscious awareness that has never been present to the same degree as I have seen it now. And it's an absolutely amazing thing. I'm extremely excited about it because this is how I've been practicing for years. And so to now see people come to the forefront and demand, not even request, but demand that their practitioner understands their health vulnerabilities in this way is extremely, extremely exciting to me. So we're going to get into that. But essentially, patients deserve a really deep dive approach to healthcare. They really, really do. And obviously, for anyone either on here or on the recording, it's really important to consider where you are in the scope of that. Are you doing blood work for your patients? Are you giving them different opportunities to understand where they're coming from? Or are you doing, and again, I hope you don't take offense to this, the naturopathic classic of vitamin D, omega-3s, and a paleo diet? There's so much more that we need to do, not just right now, but in general, there's so much more that we need to do than that. We need to be the health investigators. We need to be the diagnosticians. We need to, and I say this all the time to my patients, like, respectfully, I don't believe anyone until I've proved it myself. And it sounds egotistical, but at the same time, I'll talk about this today. I overturn diagnoses all the time. Someone comes in and they're told they have PCOS because it's a sexy diagnosis, but they don't, right? Someone comes in and they're told that their blood sugar regulation is completely fine and they have frank insulin signaling issues. Like, all of these things are really foundational to the understanding of health. And like I said, that's really what we're here to break down. And we need to, again, go beyond the basics. We need to really understand how to use research, which is constantly coming out in our favor. Like, I go through a research update every week, and I talk about how to do this in a streamlined fashion in some of my courses because it can be really overwhelming. But just yesterday, there were 5 articles that came out that essentially showed that nutraceutical compounds, whether it's herbs, whether it's vitamins, minerals, things like that, are equally and or more effective than conventional models for a lot of women's health treatment outcomes. And so it's amazing. It's amazing to watch these things. And when you're up to date on the medical literature, it is a very exciting thing to be a part of and to feel and see how deeply effective everything you do can be. And then, like I said, we need consistently effective protocols. We need really confident communication with our patients. And that is a huge area that I talk to practitioners about all the time, is if you can't predict a timeline, then you don't know your treatments well enough. And it's hard to hear, don't get me wrong. It's not a fun experience to be like, oh, great, fantastic. I can't tell a patient that they should feel this much better in 4 weeks and this much better in 8 weeks, and we're going to reassess in 12 weeks. If you don't know those timelines, it also is really hard for you to communicate effectively, to know the point at which you need to continue on, which is part of troubleshooting, right? It's like, do I continue down this path or do I pivot? And understanding the medical literature is a huge piece of how to understand that. So for anyone who doesn't know me, who's here, this is my adorable, spicy Latino son. But I think it's really important that you guys recognize that I talk about all of these things, and I am in a lot of places, but I have a picture of my son on here because I still have balance in my life. And I believe deeply that you guys can do that too. So I am a researcher. I used to do obesity and immunology research before I became a naturopathic doctor. And I'm still actively involved, like I said, every single week in understanding what's going on in that literature. And I actually might be involved in some research studies coming up soon, which is super exciting. But there's just so many opportunities for naturopathic doctors to get in and figure out the medical literature. And I think I'm proof of that. I now, even in a pandemic, which I know can be really overwhelming for a lot of people, I went from opening my doors in a new city a year ago in the beginning of March. We're now at the end of March. And since July, I've had an 8 to 10 week wait list. I had the same thing in Toronto. So you can do that. And again, I'm not like, I have marketing knowledge, but I'm not a genius. I just really run based on referrals. I give people the experiences they want. I give them the data they want. I give them predictable results. I communicate effectively. And that's really what allows them to want to send all of their friends and family. And it also makes our lives more exciting when we know about so-and-so's baby and they're talking as if you're part of the family. And it's always just such a joy in my day when I get to do that. And like I said, I run Naturopathic Mentorship. And so I've helped dozens of clinicians build extremely full practices based on this methodology, which is always super exciting for me. But like I said, the balance is such a huge piece. It breaks my heart when I hear practitioners constantly talk about working 70 to 80-hour weeks and seeing 10 patients. It doesn't have to be like that. And when you're passionate about really, really amazing care and amazing results, you too can build practices like this. It doesn't take a genius. Like I said, I've seen it multiple times over and over again. And so what we need to do, and what we'll start to do right now actually, is dive into details about how to understand when to assess an overturn diagnosis, when to pivot, and what to pivot to. Because from my experience, if you don't understand the foundations of health, if you don't understand the nitty-gritty pieces to what actually causes dis-ease, right? So not like type 2 diabetes, but like dis-ease in the body. If you don't understand those foundations, of course, how are you going to pivot? And it's not your fault. Like, we were never taught this in school, because in school, their focus is to prevent you from killing someone. And it's a really, really good focus. But your job is implementing and filling in these gaps. So there's obviously so many pieces, but this is what I see break down to every single day with my patients. So this is what we're going to go through today. So before we do that, anyone have any questions about what I mean by kind of foundations of health? I'll give you guys a second. If no one does, that's totally fine. Perfect. Okay. So like I said, the foundations I really perceive as that critical piece of the puzzle that is the foundation of the house. And if it's broken, there's only so much we can do. So dysbiosis is something that this is in no particular order, but it is foundational to so much of what we do. And after doing obesity and immunology research, I was actually going to do a study. That's when I walked away. I was getting involved with a study that looked at the interaction between herbs and the microbiome in the context of how that changed health outcomes, which was really, really cool, because we all know as doctors, you have patients where they have a really positive outcome with the same herb as someone who gets no results. And so that's a moment that you do need to pivot, because if you know, research has shown, for example, resveratrol, I'll use that. We know that resveratrol is not very bioactive, which essentially means that when it's in the gastrointestinal tract, it's not very absorbed. What has to happen is the gut microbiome has to interact with it. And when the gut microbiome interacts with it, it breaks it into different compounds, and it changes the types of bugs that are in the gut. So then you get this kind of double positive of having more anti-inflammatory species, but also requiring the gut microbiome to break down that herb into its active components, which can affect change on, for example, endometriosis. And so that was where I was going. And then stopped, decided I wanted to do clinical work, and went into naturopathic medicine. And then, as the world always turns around, ended up being the medical science liaison for a probiotic company. So my profile was VSL3 and Tuzin and BioGaia, if any of you have used any of those. So the understanding of how the microbiome affects not only our patients, but how they respond to our treatments is just been absolutely foundational to the work that I do. And I think, again, going back to this kind of naturopathic classic of you need to give a probiotic is really, really limited at best. And we're going to talk about a recurrent SIBO case today, because this is something that we see absolutely so frequently in our practices. But there is a point at which, especially when considering dysbiosis and how it impacts the immune system, blood glucose regulation, hormonal health. All of these things go back there that you need to consider, not just adding more species and hoping that they overwhelm the bad guys, but you need to foundationally consider, how am I going to kill these and what do I need to focus on? Do I need to focus on the kill plus the gastrointestinal immune response? Do I need to focus on candida? Do I need to focus on small intestinal bacteria? Do I need to focus on gram-negative species, gram-positive species? And again, I get that it can feel extremely overwhelming to be in the position where you're trying to choose that, but that is where I think clinical practice needs to go in the most loving way possible. Then we look at oxidative stress. So the second foundation there is cellular rusting, for lack of a better word. So oxidative stress, we think of in a lot of different contexts, but I like to give it to you guys how I explain it to patients, because then you can take that and explain it. But I always say, in our body, we have kind of pro-oxidants and antioxidants. So we have oxidative damage and breakdown. And when you're driving your car around, if your car starts to rust, right, we go in and get it fixed up. It can't repair itself because it doesn't have innate antioxidant status. So that's the same thing that happens in our bodies when we have an imbalance between those kind of pro-oxidants and antioxidants. So in that situation, where are those things coming from, right? So we know the outcomes in terms of what we see. We see oxidative damage to the arterial wall. We see oxidative damage, especially in the context of a women's health practice, which is what I focus on, in the context of hormones. If you have oxidative stress in the ovary, there is going to be decreased ovarian hormone production. There's going to be decreased egg quality, all of that kind of stuff. So we see that show up in a really, really big way. But then when we scale out, right, and you say, okay, let's look outside of disease, oxidative stress also looks like fatigue. It causes mitochondrial damage in a really, really significant way. And mitochondria are the energy powerhouses of the cell. So if you are missing out on the energy powerhouses of the cell, you better bet you're going to feel it in every single piece of your body. So it's so important and can be assessed on blood work. Both of these two, actually, all of these, we can get an indication using laboratory testing on what's going on. And so it is incredibly powerful. There's also a lot of research right now that's looking into endoplasmic reticulum stress and the oxidative component to that. And if you haven't looked into it, I'll be talking about it. And I've talked about it a bit on my podcast. It's just Advanced Women Health, the podcast, but I will be talking about it more, because when we understand, again, mitochondrial health and endoplasmic reticulum health, we can understand in a really big way what is happening on the whole body level with our patients. Then we get into immune dysfunction. So with immune dysfunction, we typically think of, you're like, oh yeah, my patient's inflamed. Cool. But what is causing that, and the subtlety within which the immune system is regulated, is incredibly important to have a lens on. So when we talk about inflammation, it actually doesn't mean anything, right? It's like hot, red, swollen. That's about all it means. It doesn't tell us about where it's coming from. Is it coming from the gastrointestinal tract? Is it coming from a subclinical infection that has seeded throughout the body, right? So that's when we're talking about Lyme disease, we're talking about EBV, so mono, we're talking about all of these kind of chronic viruses, CMV, that can sit there and pop their heads up. So those things are even outside of the gastrointestinal tract, although there is an influence there. When we're talking about inflammation, I also think it's really important that we are understanding that it's not just, again, like ESR and HSCRP. Those are two markers that we can look at in the blood work, but we have to look at the regulation at a deeper level. Is this an innate immune system issue, which NK cells complement? These are things that so much research is coming out on in women's health, like so much. I cannot even tell you. When you understand how those pathways are working, how much you can apply it to your women's health cases. And then we also need to understand the other arms of the immune system, which we talk about in terms of like the Th1, Th2 balance. That balance of what the immune system is doing, whether it's going to more of like a parasitic immune response or whether it's stuck in more of an autoimmune kill response, is going to very much dictate your patient's outcomes. We then also have to get into the kind of type 2 hypersensitivity responses. And if you guys haven't recognized this yet, there's so much going on with histamine responses in women's health right now. It's such a critical area. And it's, for example, PMDD. It's always been investigated with thyroid and progesterone and things like this, but we know that histamine is very involved in signaling. It's very involved in mood. It's a neurotransmitter. It's involved in pretty much every aspect of health. So if you're not recognizing the influence of that type of immune response in your practice, you're also very much going to come up short and not be able to predict outcomes. Then and stop me at any point, anyone, if you guys have questions. But then we get into glucose regulation. And in glucose regulation, I include insulin signaling because, again, no one really, like, yes, you can have symptoms from high or low blood sugar, but the subtleties in the middle, those symptoms are coming from insulin signaling issues, which is so important to understand. So with glucose signaling, I always say your brain requires oxygen and glucose. And if it doesn't have those things, it's going to put you to bed. And so when we're looking at those imbalances, we are requiring that cortisol is coming in to regulate your glucose on a consistent and daily basis if it's out of balance. Your body will defend that point of normal so closely because you could die on either side of it. And whenever we have access like that are just so foundational to the human body, for example, going back to dysbiosis, right? Sepsis could kill you. So your body's perception of bacterial imbalances, specifically gram-negative bacteria, is that you could be septic. So it is going to dedicate all of its resources to regulating that. Same with blood glucose regulation. It is literally dedicating everything possible to keeping that within normal. It doesn't care if you have brain fog. It doesn't care if you're exhausted. It doesn't care if you can't reproduce this month. All it cares is that you are within this small definition of normal so that you can live another day, so that you have the opportunity on that day to feel at your best. And so it's, again, so foundational that we're understanding and assessing these things. Anemia and nutrient deficiency is an easy one. As naturopathic doctors, we're, as a general rule, very good at looking at functional ranges for iron, right? So if someone's iron is sitting at 9, you're not going to be like, oh, great, go into the world, you're rocking it. If someone's like red blood cell count is on the borderline, their hemoglobin's 121, you're not going to be like, oh, perfect, no problem, you're healthy. We've got that handled. And so it's important, though, I think, that we are explaining that to patients, the importance of those pieces of information. Again, sleep, we use the example of sleep apnea all the time when I'm talking to practitioners. We would never say that that's not a big deal, right? A medical doctor would never be like, oh, you don't get oxygen throughout the night? Totally fine. Oh, you wake up with a headache? It's good. Don't worry. We would never have that conversation. So to then carry forward and have that conversation with glucose being low and it not being a big deal is obviously anemia with iron being low and it not being a big deal is not okay. We also don't regularly test things like vitamin D in Canada in general. It's just a test that's assumed low. But if your patient doesn't know that it's not tested because it's assumed low, their assumption is that it's not tested because it's assumed normal, right? It's those subtleties in communication that are incredibly important in educating and supporting patients to know what we do and why we're doing it differently. We also know that vitamin D controls everything, right? It controls T regulatory cells. It's controlling your immune system. It's controlling not only bone development, which is what we're told, but it has a huge impact on inflammation and mood and hormonal health. So it really does need to be considered as one of these pillars and these foundations. Then we're getting into heavy metals and toxins. So we are the most toxic world that we've ever seen. I was talking to a clinician about this morning, and we were talking about glutathione status and assessments, blood work assessments of glutathione assessments, and if it was actually always indicating low, or if it's a situation that it's like the labs are off. There's some kind of laboratory issue, and how certain patterns can bring that up. But as I was saying this morning, we are constantly bombarded with everything, right? Cleaning products, drinking water issues. If you live near a field, not near a field, where do you walk your human and or pets? all of these things are inputs, let alone considering the air pollution that none of us can control. And so when we're looking at human health and we're saying, okay, we have more processed foods than ever, plus we have more issues with pesticide exposures and metals being recycled and all of these things, we are naturally, very, very naturally going to see a bottleneck. We're very naturally going to see health outcomes from that. And recognizing their place within this mess is really, really important. So oftentimes we think of heavy metals, for example, we're oftentimes thinking of it with neurological signs and symptoms or like immune things going on or toxins in context of fertility, right? We're doing preconception support. And we're like, awesome. Okay, let's focus very specifically on cleaning things up and getting you in the best state possible so that your child does not have these hundreds of chemicals that we're seeing in the cord blood. But from that standpoint, it's so much more than that, right? We know, for example, that bacteria in the body, and when I say we, it's like me and the researchers, like we're the best of friends, but we know from the medical literature that bacteria use metals, right? That stealth infections use metals to create environments that essentially our body can't regulate, our immune system can't regulate. We know that bacteria also use iron. They have something called the siderophore. So from that standpoint, all of these pillars are also going hand in hand in hand. Even when we talk about, for example, heavy metals and that influence with dysbiosis and subclinical infections, and then we look at, okay, well, your liver is responsible for biotransformation. It's very clear how all of these things go together. And liver health is something, again, that I think it's very interesting, our relationship as naturopathic doctors with it, because there are some practitioners who are so focused on, okay, do a detox, you have to support liver health. And then we also see the opposite right now with some practitioners who are just so opposed to it. They're almost like, no, our body can do it itself. It doesn't need any support. And it's very interesting to sit in the balance of that and look at, okay, what is right for your patients? How do we support our patients in the best way? But then also very, very much helping to look at the literature and say, what is that suggesting? Because as much as I pulled away from a lot of it, and don't get me wrong, like I'll support a patient with detoxification agents if they feel strongly about it, but I had pulled away from it quite a bit in my practice because I'm like, oh, the body should be able to handle, we need to support health, we need to reduce inputs and everything will be good to go. And then now all of this literature is coming out that's showing that there is a component that we need to support with respect to the liver, not only like that relates to everything here, right? So for example, when we're looking at bile, right? Bile, typically thought of as an inert substance, now regulates incretin hormones in the gastrointestinal tract. It regulates glucose signaling and insulin signaling. It is an antimicrobial. So bile from your liver is going to be incredibly important in all of the outcomes we've talked about here: infections, oxidative stress, glucose regulation, all of these things. And it's, of course, going to help you absorb fat and carries out a lot of the things that we don't want in our body, which is why pooping is foundational, right? We want those things to be moving through. And so now going back and understanding that if we use things to support the flow of bile, right? If we use cholagogues and these herbs, which interestingly enough, more and more research is also coming out to show that a lot of the herbs we've typically used for an outcome in traditional medicine but didn't understand how it got there, go back to regulating this bile acid signaling system. And so liver health is then going to directly play into fatigue. It's going to play into your patient's immune response. It's going to play into or SIBO cases. It's going to play into everything. We can't really just look at one piece individually. We have to look at all of these foundations and be having that lens on when we're troubleshooting, which is exactly what we're going to get into now. So any questions before we do that? I'm going to drink some water. Okay, perfect. You guys are killing it. So case one here. So the way I framed these cases was because these are things that I see all of the time in my practice. each of these cases has come to me from seeing multiple other practitioners. So medical doctors, oftentimes specialists, naturopathic doctors, even functional medicine practitioners. And they're saying, okay, no one else has been able to help me. And you need to figure this out, for lack of a better word, which is always the best way to start a conversation. Sarah, just figure it out. I don't know what's going on, but figure it out. So this case here is a 55-year-old female. She presented with digestive issues. She had autoimmune, kind of non-specific. So she had not a lot of, she had body pain, but I wouldn't call it joint pain. She had a positive ANA. She did have thyroid issues. So she did have positive thyroid antibodies, even though her hormone levels were relatively intact. So she was just wanting to work specifically on the digestion and the pain and the fatigue that was going on. But also, like I said, wanted a different approach because for all intensive purposes, everything that was being done for her was not working and she couldn't figure out why. So she had recurrent positive SIBO breath tests. And when I'm saying positive, like they were not borderline, they were very, very high hydrogen and methane. And she had multiple positive tests. So in her situation, she had seen, I think it was 3 other naturopathic doctors. They had done different herbal treatments. They had done pharmaceutical treatments. So we all know there's like the typical naturopathic doctor treatments in terms of using different herbal formulas. So she had tried 2 completely different approaches to that. And then she had tried rifaximin. And then she went to a different ND before me and just did a meet and greet. And they said, oh no, the issue in your situation is that they haven't addressed the methane species enough. And this is like, she has done the elemental diet for a month. Like she's done everything. And her results came down by 1/4, but they were still very, very positive. And so this person was like, nope, you need to work on methane species. That's what's going on here. That is the big thing. And if you do that, everything will be better. And she was just so overwhelmed because she was like, another SIBO treatment. Like I had literally done the elemental diet and herbs and rifaximin and all of these things. And that was the only option that she was really provided. They had said, oh, maybe there's a thyroid component. So we'll do some motility support. But like that was about the extent of it. And so this is where now I'm going to force you guys to get involved a little bit. But based on what we talked about, what do you guys think is missing here? So a deeper understanding of dysbiosis. Is there an oxidative stress component that should be considered? Is there immune dysfunction that should be considered? Glucose regulation, anemia, heavy metals, toxins? Because I want you to use this troubleshooting guide and these kind of foundations as our template. So that's why I'm saying that. So you guys can put it in the comment section. I think I can see that. Or you can come off of mute and let me know what your next steps are, what you guys think is missing here. Again, workshop, not webinar. Anyone have thoughts?
I would say oxidative stress in her immune system, of course, with the autoimmunity and the thyroid antibodies and the positive ANA.
Awesome. Awesome. Very good. I'm going to pull up the chat here, people. Sorry about that. Inflammation, subclinical infections, nutrient deficiencies, liver support. Awesome. Dysbiosis. Perfect. Perfect. Okay. So in this situation, I'm going to tell you about what we did here. So I told her there's no point in retesting because in my situation, I often think of SIBO in general, anyways, as a symptom. I'll be completely honest. I'm not one of those people who's like, this is what's causing everything. Why bacteria back up into your gastrointestinal tract is a symptom of something bigger. So yes, if someone had a car accident, if they had really severe food poisoning, if there's abdominal surgeries or a concussion that's causing motility issues, we can understand that, but that's still a symptom, right? And so we need to be considering deeper things. So I actually, in her situation, did a GI map test because I was like, there's bugs here, but there's something bigger. She had Giardia. She had a couple of other parasites come up. She also had staph overgrowth, yeast overgrowth, incredibly low secretory IgA. And so from that standpoint, her immune system was just so overwhelmed, it could not regulate itself. And so just going down another SIBO treatment route is obviously not going to be the answer here. We had to treat these parasitic infections and everything else. Then also considering the oxidative stress component of it, right? So as much as we think about when we're looking at these patient cases, we're like, okay, what could be causing motility issues? Mitochondria are a huge source of motility. Like that needs to be happening. We need to have the mitochondria in order to efficiently have gastrointestinal motility. And so that's so important. Immune dysfunction, right? So again, the autoimmune piece is so important there. She believes she had a Yersinia infection. It didn't come up on testing, but that also is known to trigger thyroid autoimmunity, right? I wouldn't be surprised if this patient also had Lyme as well. It's just Lyme testing. I know it's arguably not very efficient in terms of picking up infection, especially the ones done by the conventional medical system. There are more functional testing that can be helpful, but in any situation, whether we're looking at these other parasites or Lyme or what have you, or these subclinical pockets, there's going to be a mitochondrial piece. There's going to be an immune piece in terms of their immune system not efficiently regulating it. And then we're also going to need to kind of zoom out and look at biofilms and how those are related to everything. Glucose regulation, you could say, like I know some people say diabetes, but that's much later on. Anemia, nutrient deficiency, I don't focus on that. And then the liver support is a huge, huge piece of this, because in these situations, we would use bile naturally to help this patient to regulate their gastrointestinal tract. And she's obviously not. Okay, next patient. So 44-year-old, hair loss. Can I get an amen? We see so many of these, right? And so she's told her iron was the problem, but she's never responded to iron. That being said, her ferritin went up to 35. Her vitamin B12 was tested. It was 198. So 2 questions here. What other things do we need to be considering? And then what other labs would you run? And you guys can, again, unmute yourself or type it into the chat box because I've got that up here. I'll give you guys a second for that. Dysbiosis, oxidative stress, love it. Thyroid, definitely. Yeah, thyroid panel, testosterone for sure. Perfect. So a couple of things I want to mention here is all of those things are correct, right? So we need to be considering thyroid. We need to be considering not only testosterone, but DHT, right? DHT is the main cause of like female pattern or male pattern hair loss. So it's really, really important to consider that when we're looking at DHT, high is the concern. When we're looking at testosterone, low or high is the concern. So we have seen hair loss documented in the literature from both high and low levels. We also need to be thinking about insulin signaling issues. We need to be thinking about inflammation and autoimmunity. So those are all really important. I think the other thing that's really important to consider is that with hair loss in general, it's on a 3 to 6 month timeline. So definitely don't forget that. It takes the anagen telogen phase, so the growth and kind of loss phase of hair is 3 to 6 months. So the intervention that I've made today, I'm not going to see the impacts out for months, likely. You can see some like baby hair sprouting and things like that, but in terms of looking for significant results, that's what we're looking at, which is also why when you're trying to figure out what's caused this, you have to look back 3 to 6 months. And that is often one, very revealing timeline, and 2, hard for people to think about. Okay, so a great question came in. Does DHT in hair loss or the skin follicle show up on serum testing? It does not. Does not. So you can obviously see DHT present in the serum, but insulin asshole sometimes in terms of insulin when it's high can interact with the follicle itself in the skin or the hair and cause the local DHT to be elevated. We only see that on biopsy, but there was a really great research article done that showed diabetes of the hair follicle is a huge reason for hair loss in women. That's what they call it, diabetes of the hair follicle. And so it is very, very interesting. There's been so many studies now done on kind of DHT and that local like biopsy method of assessment. It's very, very interesting. So in this situation, dysbiosis is a thing. It is really important to be considering, which people are like, why? And then oftentimes when I'm talking to clinicians, they go, oh, well, okay, I get it. that makes sense because that's going to prevent absorption of B12 and iron. It's so much more than that. Those bugs in the gastrointestinal tract regulate insulin signaling and glucose. We have seen that if you transplant the microbiome from a diabetic animal, and now some human studies are happening, which is weird, and then put that into a healthy human, they will gain weight and get issues with glucose. And glucotoxicity is a thing, right? So glucose in itself can also cause toxicity of the hair follicle. There's a lot of subtleties that go into this. And so dysbiosis plays into that. We also know that oxidative stress, specifically with respect to how that is going to impact hormones, has a really, really big impact. So oxidative stress can cause early graying, fun fact. So if you have a patient who's grayed completely in their 30s, you want to be looking at this. But the hormonal piece in terms of androgens causing oxidative stress and being a result of that, in terms of not having the estrogen and progesterone to balance out androgens, is a big piece. We also need to be looking again at inflammation. We need to be looking at insulin and blood sugar regulation, and then considering the anemias. And so in this patient situation, I find hair loss fun because when you have a patient that you're working with in a really robust way and they're really excited and they are willing to touch on all of the things, her insulin and glucose was a mess. She had low testosterone, which was very interesting. And then obviously we see here that her iron and her B12 were low. So between addressing the gastrointestinal issues that she had, plus each of those pieces, her hair in 3 months was already significantly growing back, and it was just done. And this is where also referrals come in, right? Because her hairdresser was like, how the heck did you do this? And so now I have like half of the clients from this one hairdresser because she's like, I don't know what to do. Go see Sarah, which is always really fun to get to see that overlap. So that's just yet another example of how you can build a really successful practice based on this. Okay. And then this is always a difficult one here, right? So 28-year-old female, chronic UTIs, almost monthly UTIs, TTC for 8 months, 1 miscarriage, and then otherwise nothing, digestive issues and abdominal pain. So which direction would you guys be going? What would you think of here? What's missing? What do we need to troubleshoot? She's been on antibiotics for each of them. She'd seen a couple other naturopathic doctors. They had tried some kind of typical herbs. So dysbiosis is a big one. Yeah. Anyone else? Dysbiosis, insulin. Yeah. Yeah, for sure. With UTIs, we oftentimes do need to consider that blood sugar relationship, immune system. Yeah. Perfect. So in this patient situation, it is, again, it's considering a lot of these things. It's dysbiosis, but I think it's more than dysbiosis because, as I said, she had done the typical UTI herbs with other practitioners. She had done echinacea. She had done the berberine alkaloids. She had done all of the urinary antiseptic herbs and wasn't getting anywhere. And that's because in these situations, more than ever, we need to be considering the environment and we need to be considering biofilms and the bacterial composition of those things. So with those biofilms, I'm doing this because biofilms are this kind of mucopolysaccharide component that is intended, to be honest, like we all have healthy biofilms. It's intended to hold good bacteria in its place. But when we get bad bacteria in there and it changes something called quorum sensing, which is that like communication between the different bugs in the gut. And I use the example of a cuttlefish. If you guys have ever seen, they change colors really quickly. And one of the belief systems around how they do that is by bacteria communicating about which color. So when your microbiome goes from green and happy and anti-inflammatory to red, and that switch happens really quickly, we start to make these really thick biofilms that protect the bugs against our immune system. And it's really important to understand the treatment of biofilms because we're seeing them so much more now than we ever have before, just because of the nature of pressure that's placed on these bugs and how they need to compensate for that and change for that. So that's a huge thing that we need to consider. Also, when we look at UTIs almost monthly, there's a lot of questions that need to happen around that. Is that surrounding intercourse? Is that surrounding your period? Is there a pattern to this? And I think in my practice, I also see that it's very important to, again, be the skeptic in this situation. So have you had this cultured? If you haven't had it consistently cultured and they just see leukocytes or a little bit of blood, depending on where you are in your cycle, when you last had intercourse, that's normal. And I don't know about you guys, but I have really gotten very, very specific with each of my patients on how their dipsticks are done. Did you do a clean catch, AKA pee in the toilet first, then pee in the cup? No one is being told to do that right now. And it's a huge issue because your urethra obviously has bacteria. There's going to be mucus and white blood cells and all of that kind of stuff. So if we are just then falling forward and telling a patient, oh, you have a UTI based on urethral urine, it's not helpful. We're supposed to be looking at the bladder. And so it's really important to consider culturing, to consider knowing what species are there. And then we also need to consider the vaginal microbiome and biofilms and all of these things together, which I know feels really overwhelming because you're like, I just want to give echinacea berberine and make it go away. It's just not the reality, to be honest, of so many of our practices right now. So consistent culturing is really important because I can tell you in this case, and I'll go through the different pieces and why we need to consider those. But in her situation, when we did cultures, it wasn't actually a UTI. So this patient is receiving monthly antibiotics and had nothing on culture consistently. So in that situation, what would you guys think of? What would your next mind go to? She's got digestive issues, abdominal pain. She's been trying to conceive, and she actually does not have anything present on culture consistently. What would you think of? Yeah, endometriosis. That's one of the answers that came in. Exactly. And then the other thing to think of too is interstitial cystitis, right? So IC is often caused by endo. It's caused by pelvic inflammation in general. But in this patient situation, she had just had an ultrasound the year before, but I pushed really hard for her to get another ultrasound, and she did have endometriomas on both ovaries. So this is incredibly important that we are doing this work because now we've been able to start treatment and see really amazing results and help her down that path. Whereas for a whole year, she had had monthly UTIs. She'd been either trying to conceive or thinking about it. She had massive abdominal pain and she was told you have IBS and you're anxious and you need to wipe front to back, right? So that sophistication in terms of what we can bring is obviously going to bring a ton of people to our practices because endo is an immune system condition that's affected by hormones. It's not a hormonal condition. And when you understand that and you can make really efficient and effective changes to your patient's protocols, magic happens and patients get better. And that's ultimately, like, I know that's what you're here for. That's what I'm here for. Like, I love leaving the end of my day and seeing 10 patients and them being like, oh, awesome. I'm better. Here's our next steps. Like, it's so clear. And it's just so rewarding to get to be that person that I know I needed in my healthcare journey. And that so many of our patients need. So alas, I get excited about that. But so dysbiosis, we talked about in terms of the biofilm component, oxidative stress. So we know that endometriosis creates an incredibly oxidative stressful, if that's a word. And there's a lot of oxidative damage that happens in endometriosis. So we need to be considering that. There's also a huge histamine component, right? So when we're looking at kind of that immune dysfunction piece, there is a histamine component to endometriosis. Across the board, we're understanding that both IC and endo have a histaminergic component. So you don't need to have those Hunner's lesions in order to have those symptoms of IC. And again, if this patient had just continued down the antibiotic route, I can only imagine where we would have been. And so the fact that now I think she's been 6 months or so without any UTIs, it's an amazing thing to be able to help someone through. Glucose regulation, you're right, like not necessarily present in this patient situation, but if there is an issue with glucose regulation, we can see that show up. Heavy metals, right, and toxicity component, a lot of that is being filtered and a lot of that is involved with biofilms, which we need to be considering. Anything that is also, I didn't put this in here, but I'm going to kind of call this heavy metal structural / metal in your uterus. Any IUD, whether it's copper or hormone, whatever, any device that's in the vagina on a consistent basis has the ability to form these biofilms and be seeding natures. So it can then, right, we're like, oh, how are UTIs and vaginal biofilms involved, they are directly involved because biofilms can ascend into the bladder and cause issues. And a seeding source may actually be an IUD. And I see that all the time. And I talk about that in my programs all the time. And then again, because of the nature of biotransformation and the nature of hormonal balance and all of these things that need to occur in order to properly regulate bacteria and the immune system, the liver is inevitably involved with that. So any questions about that? I know it's a fun one. If anyone has questions, you can pop them in the chat box. You guys have been great. So that is the overview of today's presentation. I really, really hope, like I said, I wanted it to be speedy. I wanted it to give you results. I wanted you guys to be able to go through and look at each of these paces with your patients. I wanted you to be able to be like, okay, perfect. This is what my checklist is. This is what I need to go through. And then from that standpoint, be able to affect change in someone's life tomorrow, because naturopathic doctors have the ability to do that in a massive way. I see it every single day. And you better bet it is what lights a fire out of my butt to get out here and help you guys. Because between all of the different talks that I've been doing lately, I see so many practitioners coming back to me and messaging me and being like, my practice has changed. Everything has changed. It's just amazing. Like when you see it, you can't unsee it, I guess. So if you do want to understand more, not just about assessment, but about treatment and really what you should be doing, then I do have Advanced Women's Therapeutics that is launching very soon. So April 12th. It is not just protocols though. I'm not just walking you through, this is what I do, and this is the research in every patient case. We show up every single week live and we troubleshoot in these ways. And we're going through, okay, I have no idea what to do with this patient. Where do I go from here? And instead of feeling alone and feeling like a bad practitioner, which I hear all the time, is people are like, I don't know what to do. I'm not a good person. I'm not a good practitioner. And then leaving medicine, which I have actually heard. We can come together and create the community of support, which is what is needed to grow. It's what's needed to make all of these treatments feel super manageable. So like I said, it's 12 weeks. It's every single Monday at 10 a.m. EST. We go through things weekly live, and you'll get a recording of both the live sessions, but then also a recording that you get to watch beforehand. So you come prepared, and then we show up with the live troubleshooting cases. I also do, because I'm so pro community, I have a group of 3 discounts. You guys can email me if you want more to know more about that. So right now it is $1,500, but if you use the coupon that's GROW 2021, you get $200. If you're doing the full price payment, you get $200 off of that, because again, I want people in here. And if you can get 5 new patients every week with this content, instead of sitting there twiddling your thumbs, I personally think it's worth it. And I see so many patients and so many practitioners really getting amazing results. So naturopathicmentorship.com/advanced women's therapeutics, or AWT. That is where you find all of this information and to register. And of course, you guys can hit me up on any kind of social platform or email me, but we're going to go through efficient and effective research. We're going to go through lab testing and what to do. We're going to go more in depth about how to treat all of these foundations, how to manage complex digestive conditions, weight loss, thyroid management and prescribing, PCOS, endometriosis, preconception, postpartum. Everything you need for a women's health practice will be established, or at least the beginnings of it will be established in this period of time. So I am here to answer any questions you guys have in the next couple of minutes, but I so respect your time. And if anyone wants to touch base afterwards, you feel free to reach out as well. Okay, thank you. Thank you guys for coming very much. It is always so much fun to do this.